a look at two cases of my patients, two very beautiful young ladies. First is Lam Lam. She's now 11 years old. When she was born in November 1999, she was immediately hospitalized for 3 months. She was diagnosed having Cat-Scratch syndrome, a special and rare DNA disease. Cat-Scratch syndrome is a chromosomal condition that results with a pair of chromosome 5 is missing. Infants with these conditions often find a high-pitched cry that sounds like of a cat. Okay. The disorder is characterized by intellectual disability and delayed development. This is third cases which I have ever seen so far, said by the doctors in Clinical Genetic Cell Service of Department of Health in Prince of Wales Hospital. Can you believe how rare it is? But look at the picture when she was 2 months old. This is okay. You can tell she had a full round forehead and very normal structure in her nose. She looked just like a normal baby. Right before she was discharged to go back home with her loving parents, she was arranged to receive all injections, just like any other infant. This picture was taken on the last day she got discharged from hospital when she was 3 months old. She looked okay, just a little tired. 25 days later, can you notice any difference on her outlook? Let's have a close look what happened to this little one now. Yes, she seems to cause edema. Maybe she couldn't settle with her life with her parents. Maybe the injections are too much for her. I don't know. Yes. As she gets better, she looks a little puffy 1 month later. Can you recognize who this is? This is Lam Lam, 4 years old. After the puffiness had gone, she looks different. Can you notice the structure of her lateral forehead had changed? Her forehead became more narrowed. Her eyes set widened. And her structure of her nose shortened. As she grows, those structural abnormalities become more obvious.
Were you treating her at this time?
No.
Okay.
She is half-year-old now. Does she still look like when she was born? Let's have a closer look at her leg. Here. Oh, no, here. The structure of her legs looked different from the other children. She's 2 years old now. She has undergone several tests to measure intellectual ability and has been classified in the category of moderate to severe mental retardation. When she was 3 years old, she can stand all right without any help. But sadly, she couldn't walk properly. Okay, this is the first time I met her in November 2006. It is apparent that she is intellectually disabled, although her anterior physical structure looked normal. But when she walked, she always leaned forward. She looks normally laterally and posterior. In 2007, after 1 year of treatment, can you tell a big difference from her appearance? What do you think about her intellectual ability? Can you read from her face? Look at her walking posture. She can walk on her own. She can even run. The next year in 2008, after 2 years of treatment, her appearance became more mature. Lam Lam has grown a lot. Guess what? She won a golden trophy in the athletic contest in school.
Is she in a special school? She's still in a special school.
Special.
So her intellectual ability has
Yes.
improved.
Yeah, later.
Oh, sorry.
Later. Not so far. Not so fast. Because
Sorry.
not every year. Then not checked every other month. Just for a long time. Okay.
Yeah.
So, but on outlook and when she talked with her parents and with us, then we can definitely distinguish the little.
The key thing is actually when in the first 6 months, you know, for an intellectual.
No. And when it's 3 years old, when she go to school.
They did some tests in the first 6 months stimulating babies, and they found that they got a 20-point increase in their IQs by stimulating them very early. So that maybe that's also just passing to you too late.
Well, I know her when she was 7.
Yes, it's too late.
That's okay. This picture was taken on the, okay, next one. This picture was taken on the day she graduated from primary school. She was progressed a lot. She had undergone a test to measure intellectual ability recently. This time she was classified in a category of mild to moderate mental retardation instead of severe one. So she has gone a lot, but many people seem to ignore some small but profound changes in her body structure. When she was in her infancy, the structure of her toes were perfectly normal. Then look at the recent photo of her toes. The structure became abnormal. This is when she grows up. Okay, let's have another look at the structure of her hands, especially her fingers. As she grows, the structure changes. We came to realize that most of the patients suffering in brain damage or incomplete development since infancy, you can easily tell from the appearance of their physical structure of the limbs. Those structural abnormalities are rather common, thus changes on those abnormalities are the index of how much change developed in the brain. Later we can change, and it shows that there's improvement in the brain. We came to realize that most of the patients suffering brain damage or incomplete development since infancy, you can easily tell from the appearance of their physical structure of the limbs. Those structural abnormalities are rather common. Okay. So now, I would like to share another story of a young lady, Candy. Candy started inhaling pain thinner when she was 15 years old in 1997. Studying brain 202 due to blurred vision, she had an eye examination Hong Kong Eye Hospital. She was diagnosed optic nerve infection and hospitalized for 3 days. One day in the late summer 2004, she continued to inhale pain thinner for 1.5 months, and then her vision began to blur again. She had blurred eyesight at about 1 feet distance. She lost the ability to work, to walk, to talk, or to lift any objects. She was given steroid injections again, but her sickness still continued, and often admitted due to serious headaches and dizziness. She had an MRI scan in 2005 and found that she had permanent brain injury. In April 2006, she abused in thinner inhalation again. When she was admitted, she could not identify colors and had blurred vision again. She could hardly walk without aid. She could not use her hands to eat or to lift objects. She stayed in hospital for 1 week, and her doctors point that her brain injury is going to be permanent and incurable. Candy started to receive therapy from my team in April 2007. Through her visit in the first few months, she went through heavy stress emotionally. She still inhaled thinner from time to time. 4 months later, Candy revealed her tremor improved profoundly, and she gained weight, sleeping quality improved, vision improved. This picture was taken after 1 year treatment. She can go out with us, but she still had edema. She loves hanging out with us, and we're so happy that we can walk. She can walk without any help. She became more independent. She became happier and stopped inhaling thinner since then. This is the story of Candy. She progressed a lot, so much. She achieved so much, and she's so proud, and we're so proud of her. Even she was diagnosed of permanent brain injury, and we did not give up and keep working on her physical side. So she is happy, healthy, and energetic. Well, before we finish today's sharing, we'd like to end with a quote. If you think our body and mind are two, that's wrong. But you think that is one, that's also wrong. Our mind and body are both one and two. We cannot achieve health in one aspect without taking care of the other. One step at a time, we become whole. Thank you.
Thank you very much.